My name is Kathy Hamilton, and I'm having a lower lid sliver today. I have a lot of genetically crepey skin under my eyes, and I'm a contact wearer, and so pulling and tugging of my lower lids and age and gravity don't help the fact that we lose so much collagen every year, and so because of that, the eyes are one of the hardest areas to tighten. I've had my upper lids done 4 years ago, and I'm actually right now having a revision of my lower lids, a lower lid sliver. I will be so glad when this is said and done, because it's an area of mine that I'm always most focused on. Looking in the mirror every day, we as women are our own worst critics, and staring at my crepiness under my eyes every day has just always been an issue of mine that I've had since I was in my 30s. And it's something I've always wanted to do, and very glad that I'm having the opportunity to do it today.
Kathy's having a lower lid blepharoplasty, which we call in the office a lower skin sliver, because we're not taking out fat. We're just taking some of that crinkly skin that forms around that lower eyelid, particularly in people who have thin skin and smile a lot. And Kathy does smile a lot, and so we've done her previously we've done her upper eyelids, and you can see what a beautiful result she has. She has beautiful eyes, and she's taking good care of her skin, but the lower eyelid is quite thin. And that's probably something she's inherited. And the combination of her smiling has made this skin, this area, quite crinkly and has made some excess. We've treated the most lateral, by that we mean the most side aspect of that, where the crow's feet are, with Botox, which is a non-surgical approach. But now, at some point where people smile too much, they develop too much skin. So what we do is we take a small amount of that skin by the lower eyelid. It takes about 30 to 40 minutes to do. We often do it in the office, in fact the majority of the time when it's an isolated procedure, and we put a little numbing medicine in, and we measure exactly what we're going to take out, and you can see hopefully that we take that off in a relatively expedient fashion, and then put a running suture there, and so that suture stays in about a week, and then we take it out after a week. Now we numb the patient and give them pain medicine, and usually a Valium, and that usually is sufficient for them to have actually a relatively easy process through the procedure. The question that I get asked a lot is, how do you know how much to take? And we measure. And so the key thing is that she's sitting upright, and I'm taking a forceps that has a little bit of ink on the end, and that way I can measure exactly what to take, no more, no less. And so it's customized to her. The idea is to customize this to her by taking just what I need, no more, no less. So I blot so that the ink doesn't go everywhere. This is a special surgical marker, but you can see she has a beautiful face, but the fine lines around her eyes are incongruent with the nice skin everywhere else. So we're just going to put things back where it should be. Okay, you can lay down now. The first thing we're going to do, I'm going to put some numbing drops in her eye, because we put a special contact in that will protect the eye while we're doing the surgery. Her eye is numb now, so I'm going to put a little contact in her eye, in close, and it's opaque so you don't see. Now, we're not going to put another one in, because that would potentially make her feel a little uncomfortable. So that way, her eye is completely protected, and that way we can put some numbing medicine in and then do the surgery. I'm putting a little bit of medicine to clean the skin, which is an antiseptic that has iodine in it. We've already put a numbing cream on, which helps numb the skin, and so the needle stick doesn't hurt very much. There's a little bit of burning involved, but you'll see we're going to inject a little bit along the lower eyelid. So, Kathy, you're going to feel a little pinch here in the lower eyelid right here. You ready? Mm-hmm. Little stick, 1, 2, 3 stick, a little burn. And that's it. We put a little stick like that. It feels like a little bee sting. And then we let that sit for a little bit, and that will numb up the skin as well as shrink the blood vessels so there's less bruising. I'm going to do one more and we're going to be quick and we'll be done. And that's it. And so I'm finished with the numbing part. Now she's going to be numb along that lower eyelid. Her eyelid will feel a little swollen. She has the contact in. I'm going to put a little bit more here on the side, just where I see she might have a little more excess. Am I hurting you there? Mm-hmm. Good. And so right now she's numb, and we can go ahead and set things up and prepare to do the surgery. We've numbed her up, and we've waited a few minutes for the numbing medicine to work. It also shrinks the blood vessels so there's less bruising. But now what we're going to do is we're going to take a sliver of that skin that we've marked. It's also called a pinch blepharoplasty. Blepharo means eyelid in Greek, of course, and plasty means to shape. So this is a pinch because as a double check, right next to her beautiful long lashes, we are pinching with a little forceps to guess exactly how much skin we're going to take. We're not guessing, actually, we're measuring exactly. And you can see it corresponds very nicely to my pre-operative markings. Now we're going to just excise that. Kathy, are you hurting at all?
Not at all.
Okay, excellent. So she's numb. I have Beth here, who's my assistant, and she may help me hold the eyelid and such as we go. And so we're going to start here in just a second. With a very fine scissors. And you can see we can take a fairly wide little strip of skin, all that crinkly skin, smiley skin, right underneath her eyelashes. And as I said, the most challenging part is actually doing it without cutting any of her eyelashes, which so far so good. We've taken a little bit of skin, and now we're going to cauterize, which means we're just going to, with a little, almost like a little handheld laser, it's called a Colorado tip cautery, and we're going to just cauterize the little blood vessels so it reduces bleeding, so she has less bruising, and it helps healing. And you can see why we put that special contact in, because it's protecting her eye the whole time. So that's helped us cauterize the bleeding, so there's very little bleeding. And then we, again, just modify the incision the way I want it. And you can see that's going to bring her up, and then we're going to put a stitch in. That we've prepared. And you can see we just sew that incision right back up next to the eyelashes. And what's nice is that incision is hidden well enough that often it enhances or looks like eyeliner. But as you saw in her previous one, where I'm putting the incision exactly again, once it heals, it's very hard to see. And one of the ideas of this procedure is we're not only taking out skin and pulling it up, but we're putting the skin back where it should be, which is up and out. Because as we age, the skin falls down at an angle. It sort of falls down towards our nose and mouth. And so the nice thing about taking out a little bit of this skin and then pulling it up in the correct direction is that it gives you a little bit of a cheek lift as well. We're simply putting it right back together again. You doing okay in there, Kathy?
Great.
She's doing super. And we're going to bunch it up just a little bit on the corner because part of the bunching is swelling. And all that comes down when we take the stitch out. So we purposely leave a little bit of bunchiness in the corner. And that finishes our incision. And we put her back together. And it given her a little bit of a cheek lift to boot, which is always a nice bonus. So this is just a little sliver. That's why we call it a pinch or a sliver. and basically gets rid of a lot of that little excess skin underneath our eyelashes that unfortunately very few other things help. Okay, very good. So now we're going to take the contact out and we're going to go to the other side. And now we've numbed her up on the other side and put the contact, we've moved, we put a new contact in on this side, changed our gloves. And now the hard part is to getting her eyelashes out of the way because they are beautiful and long. And so we just rub them out of the way a little bit. She has numbing medicine in, so we're going to pinch a little bit to make sure. That's why I think it's so important that surgeons measure exactly what they're going to take. And so we pinch. In addition to having measured, you can see it's exactly at the line that I drew preoperatively and what my plan encompassed in terms of what I was going to take out. And she knew that she has a little bit more skin on this side, so we're probably going to take out a little bit more compared to her right side. So the left has a little bit more, and she knew that. And so we're customizing it to her. She must wink more on the left than the right. And most people are asymmetric. Everybody expects to be symmetric, but they're actually not. They've done these nice studies with mirrors to show that people are asymmetric in their face. And so that's why it doesn't make sense that in the past people would always take the same amount out. Now it's nice, it's a nice guide as a general rule, but it's not exact. And the way to do that is to be exact to each side. So I'm going to start again on this side by taking a small amount of skin right next to her eyelash. And you can see I'm following the pattern of what I pinched as well as the line that I made. And we're putting, the incision will end up right next to her eyelashes, just like it did before. And now we're going to cauterize to decrease bruising. And so what I'm doing is every little blood vessel, I'm cauterizing it with this very nice handheld cautery. It's very exact. It's a tungsten tip, so it's very exact in its delivery of the energy, which allows us to cauterize very small vessels without hurting the surrounding tissue. And that really has helped reduce bruising. So you can let go for a minute. Now we're going to put that stitch back in. So you can see the beauty of doing things in the office when appropriate. There are some things that are not appropriate to do in the office, but when you're just taking skin, then most of the time you can do things under this local anesthesia without having to have an IV. The patient is awake. The worst thing is they usually have to listen to my jokes. But in general, the nice thing is that they go home, they don't have the after effects of a general anesthetic or even a deep sedation, which can be very much like a general anesthetic. And as a result, they're not nauseated, it's well tolerated. The key thing is to keep your head elevated post-operatively and put some cold compresses, and that helps with the swelling. And generally the patients describe that they don't have very much discomfort. Some of them, we give pain medicine, but many of them just take extra-strength Tylenol. But everybody's a little different in that regard. So we try to keep people comfortable. But the nice thing is I find that if they don't have all those other issues with anesthesia, they really tend to do marvelously and are back to work and healing quite nicely, usually within a week or two. Certainly most people have a week, so we try to schedule this so they can take their week off, have their stitches, and go back to work. It's really a nice, beautiful little procedure that allows us to pick up the excess skin helped with some of those wrinkles by removing the redundancy of skin and then finally giving a little bit of a lift. And I think that's been one of the really nice things. I think it also delays some of the aging of the eye. Because as we age, the lower eyelid begins to droop. And so this is a nice way to help with that as well. So I'm putting a little antibiotic ointment on. Are you hurting at all?
Not at all.
No. Numbing medicine will be there for a couple hours, and then she'll be starting on some cold compresses and pain medicine so she can have a nice relaxing evening listening to, I'm sure, some good music. So, and there we have a sliver blepharoplasty.